All right, welcome to orientation. I'm going to share my screen and I'm going to take you guys right into the PowerPoint that I have ready for us for our little orientation. I am going to work very diligently to keep this to an hour because this is a Sunday and I do not want to take up more time than you guys did not plan for originally. But welcome to AGP-CNP. You guys are now heading into the core. I'm going to talk a little bit about coming into the practicum courses, and I'll share a little bit about how things become different now that you've hit the core and you have finished off with the general foundational courses. So we're going to talk a little bit about APA format, talk a little bit about communication style. We use a program called InPlace from here on out, and there's a lot of communication that's going to occur with you that will occur within InPlace. So your clinical placements you will find in InPlace, and I'll get into that. And then I'm going to talk to you about your practicum and your preceptor and what do you have to do and how do you have to do it and what's the time frame to do it. So this is the InPlace sign-in, and you will sign in with your credentials for the University of Colorado, and it'll take you right into your student page. In the course 5971, there are videos for you to watch on how do you use InPlace and how do you record in InPlace. I believe there's 8 or 9 of them. Please watch each one of them because each one covers a different topic. I have had students in the past when they were having difficulties with InPlace and communicated with me that the issue was my issue, that I had not provided proper guidance, orientation, or education on the elements of InPlace. It is your responsibility to look at those videos because they explain all those elements to you. If you make the choice not to look at one of the videos, then you're making the choice not to learn that information, and then it becomes your responsibility and not ownership on me that I didn't teach you about it, because those videos were made to reduce the time that I have to talk with you in this kind of a format and allow you to be able to have InPlace up at the same time the video is running so you can actually test out the different things that it's showing you how to do. So just an FYI on that. I've had that come across in a couple evaluations, and I promised my supervisor that I would address it point blankly and explain it to you guys so that there's no confusion about whose responsibility that lays upon. In this course, you will be doing a lot of writing, and you'll be writing some goals, and then you'll be writing reflections on those goals. And I'm going to talk to you about how do you do that. We use a completely different communication tool as an advanced practice nurse than you do as a nurse. So as a nurse, you guys are really familiar with SBAR. But SBAR is a passive communication tool, and you are a provider, and we have no passivity as a provider. We have strong orientation and determination of our statements. And the SNAPS tool helps you to do that so that you're not providing an image to someone you're talking to of your uncertainty. SNAPS demonstrates your certainty and also allows you to gain further insight and knowledge from someone you're working with. And then we're going to talk a little bit about note writing. Now, I know that you guys have written notes in your patho class and you have written some notes in your advanced assessment class. We are going to be taking those 2 courses and blending them together into reality of how do you really do this. And it's a little bit different than what you might think, and it's a lot harder than you think. And when you hit this course that you're coming into, 5971, and coming into 6819, your health promotions course, it's really like getting doused with a bucket of ice water, because it's a shock that you are an expert as a nurse, but coming into the core, you feel like you're a subterranean slugworth and you know absolutely nothing, and your ego becomes effective, and you sometimes can go on the defense as a student for how you're doing things. I highly encourage you to check the defense and leave it sitting on the table. Allow your mind to be open-minded to the learning that is being brought to you by the very well-educated and seasoned providers that will be working with you, which includes myself and the other teachers in the program. We've been doing this a long time, and we're trying to share with you pearls and key takeaways to make it easier for you to gain the understanding of how to do from a textbook to the reality of the application. And if you have defense, you're not going to do that well. And it is 100% okay not to know how to do it. And it's 100% okay to say that in the courses. We expect you to. So when you make a statement as a student, and that statement reflects that you're perfect and that nothing related to the assignments brought you any benefit, you're going to raise red flags in us that you're not seeing the benefit of the learning, and that you may believe you know it all when you really don't. So check that kind of attitude also at the door, and don't bring it forward that you know everything, because you really don't. This first course, 5971, is specifically geared to help you transition from textbook knowledge to knowledge translation in the real world. And we've very strategically done this because students in the past have really struggled and not been able to do it well. And the community preceptors identified that as a major gap. So we addressed that gap and restructured the program to support this transitioning from textbook to real world application. And it's going to feel foreign to you guys. Just be aware of that. It's not going to feel comfortable. It's going to feel very odd. And because you're an expert nurse, it makes you feel like you don't know what the heck you're doing. You do, but you have to give yourself permission to learn the process of translation. And that's where we come in as your teachers. We're really good at working with you and guiding you. Please read the feedback that we give you, because it's relevant to help you be an expert provider. When you're working on writing your goals, these goals are going to relate to the competencies that are associated with your very first practicum course. And those competencies you will find located on your preceptor evaluation form, and they're color coded out for what types of competencies they are. As an FYI, it's the second week of January. We are being oriented to a new set of competencies that are being rolled out by ANCC, AANP, the ANA, which are going to correlate back into NOF. And not in your spring semester, but probably in your summer and your fall, the competencies and the way we need to have you demonstrate that you're able to achieve them is probably going to change because of these new competency writings and how we're being told we have to demonstrate your abilities. So just an FYI on that. If we do have to do this, we will go ahead and provide an orientation to you on, okay, guys, here are the changes. Here's how we have to change the program to do this. We may be really lucky that those of us that worked on restructuring and redesigning the AG program were forward-thinking, and we may not have to change anything at all. And I'm hoping that that is so. So just wanted to give you an FYI on that. So there's a lot of guidelines out there, you guys, and guidelines really do help us direct care, especially when we're new to being a provider and we're trying to figure out, so what am I supposed to do for a sinus infection? Do I put them in antibiotics? Am I supposed to use a nonsteroidal? Do I use a steroid? What do I do? How do I treat pneumonia? Well, you turn to the guidelines, and the guidelines provide you with very clear direction that's evidence-based. And as you're using these guidelines to help determine how you should do care for a patient, it also helps you start building up your memory and forming puzzle pieces together on how things are done for very specific types of medical diagnoses. So the example I provided you here is an example of how to write a goal using a SMART format. By the end of June, I will have researched and applied a current guideline to direct care of a patient. This is extremely broad and it could use some refinement. So here's how I would refine this. By the end of June is great. Researched and applied a current guideline to direct patient care. That's where we need to be more specific. So apply a current guideline to, at minimum, 2 patients to 3 patients that I care for over the month of June for varied medical diagnoses. Now you got more specific. So let's show you an example. These are actual SMART goals that were written by a student in our past who has given us permission to share them with you. And as you read the goals, you're able to see that they're in a SMART goal format. By the end of September, I will have created my own personal templates for history, HPIP, and ROS gathering, which is the focus of 5971. So this student wanted to be able to use the way her brain worked to develop a template to help her be able to translate the knowledge that she learned from patho and advanced assessment to the way her brain worked. We provide you with tools, but these tools may not be the way your brain works because each brain works a little bit differently. So to help augment the learning process, this is an excellent goal. Number 2, by the end of September, I will be able to independently perform a complete history and physical on 4 patients. You are going to be at minimum with your preceptor once a week. And because you're with your preceptor once a week, if this person would have just said, I'm 1 patient, so basically for the whole month, you're planning just to try to meet this just once, it's not enough. So you need to be very specific. And if you're not, we're going to tell you how you need to be more specific, and we want that goal rewritten. And then you see goal number 3. And it seems like these are really simple goals to make, but I'll be straightforward with you. Applying your textbook knowledge into a real interview process is not as easy as what it was when you were doing these courses, because you're dealing with a real human and you have to be organized and you don't understand how to ask the questions or the formatting of how you need to ask the questions or how it ties in properly. So 5971 is going to help you hone that skill really strongly moving forward. And this is the reflection. So first you write your goals, and then you write a reflection of your goal. Now your reflection of your goal can't just be stated, I met goal number 1, I did it, I found it to be kind of hard. You have to tell me how you did it. What barriers did you have encountered? How did you put things together? Did you find in the end that you actually wrote a goal that was too broad for your current base of knowledge and understanding and role? It may be. You have to speak honestly in your reflection. And if you say you did it perfectly, it's your very first goal. Do you believe you're going to do everything perfect? Everybody, no matter how long we've been in practice, gains new understanding every day we work with a patient. So there has to be something that you learned, and not about perfectism, but about the role that you're assuming as a nurse practitioner. So you can read over this and you can see that She talked about that she felt comfortable in the setting. She did her own process. She had to tweak it because she figured out that she needed some additional prompters to some of the questions. And then she, at the end, stated that she thinks that this is going to evolve as she works on this and become a really good tool for her for information gathering. And she's right, it will be. Look at goal number 2. By the end of September, I will be able to independently perform a complete history and physical. Now, when you make statements like this student has for a goal, we're going to hold you to the absolute ability to do this. And you can see what she wrote. She didn't really understand what this really meant. A complete history and physical, doing it from memory and working with the patient and not missing anything is really hard to do. And staying organized with it and making sure that you ask all those right questions when you get to your ROS, which is your review of systems. It's like, oh my God, I just fell into the sand trap. It's hard, but it's a good goal to work on. And you can write a goal that's broad and we'll let you go for it. We may counsel you a little bit. You think you want to change this, and here are the reasons why we're thinking that. But if you really want to try it and you do it, and then you find, I bit off way too much. I couldn't achieve the goal. But you learned from that goal. What did you learn? And do you want to try it again for the next month? And you can ask permission to do that. So the reflection needs to be honest, transparent to what occurred. Were you really able to achieve it? What did you achieve and how did you achieve it? You have to tell us all of this. If you don't, we do use rubrics for all the grading and points will be taken off because you're not clearly explaining to us how you met the goal. This is your SNAPS tool, and you have this available to you in the course once we open it up to you. And it is really, really great. So on the left-hand side, it explains what SNAPS means. And on the right-hand side, it helps you understand, so how do you use this? So SNAPS is a summary, a brief history of the findings, narrow down your differential diagnoses. You're going to speak to why you chose those top 3 diagnoses. You're going to probe the preceptor or ask questions. With what I've stated to you, is there anything that I may have missed or ways you would have done things differently? Explain out your plan. Sinus infection at this time, I don't believe it's bacterial. It is probably viral. We're going to use over-the-counter medications, but I'll have the patient follow up X and Y and Z. And then ask a question that relates to your learning. So with what I just said in relationship to the plan, does this follow the guidelines or did I miss something in the guidelines? So it allows your preceptor to work with you and help you gain confidence in what you're doing and start putting together memorized care processes that go with specific medical problems. On to the right. This is a really cool worksheet, and this worksheet helps keep you focused on what to say. So we start off with the chief complaint, patient complaint, probable sinus infection. We use the old card, onset, location, duration, characteristics, aggravating, relieving, treatment, symptoms. Any pertinent history, patient has had past surgeries for turbinate, aeration, significant allergies, no tests are required. Physical exam demonstrated the turbinates to be grossly edematous, hot red in appearance, thick green purulence, nasal discharge, with the posterior pharynx being erythemic and the discharge in the posterior pharynx. Positive anterior posterior lymph and postauricular, eardrums, TMs bilaterally with air fluid levels present. So you want to describe things, but do it very quickly. Okay. Then narrow down the differential diagnoses. You want to put the one that is what you actually think is going on first. Sinus infection. Number 2, eustachian tube dysfunction. Number 3, viral upper respiratory infection. And then the probing of the preceptor, where you can ask the questions. Is there anything I missed? I wasn't really sure how to educate the patient on this. What would you suggest? So this allows you to gain learning from your preceptor, but yet you own a large component of being organized and thinking through the process. As you can see from SNAPS, applying your learned knowledge is what we do with SNAPS, and it's not easy. You have to be organized, and SNAPS demonstrates to you how you're not organized and how you need to get better organized. I would highly encourage you guys all, if you don't already know how to use Old Cart, figure out how to use it, because you're going to start using it right away when you enter into clinicals. So InPlace is the program in which we document just about everything that you guys are going to be doing in your clinicals. So you will be documenting per the instructions in the course, and each practicum course has a little different instructions for documentation when it comes to how many notes you have to write. But what you're putting into InPlace is all the same. And I'll show you a couple examples here in just a second. So you're going to put into InPlace when you go to do a session, which is what it's called. You'll put in your patient age, gender, and race. Activities are the amount of time you spent with the patient, looking things up, consulting with the preceptor, educating the patient. That's very simple. Clinical information, this is going to be what's the reason the patient came. So the chief complained. Was it an acute patient visit? Was it a follow-up? What was it? And then type of history that you did, is it focused? Like with a sinus infection, it's going to be really focused. Was it expanded where there may be a pulmonary component to it? Or was it a comprehensive examination where you did a full physical, or the patient had a complicated chief complaint like chest pain or fever of unknown origin, which makes it highly complex. I'm going to talk to you a little bit about industry codes, and you'll learn more about these as you're working with your preceptor. We use two different types of codes inside of InPlace. One of them is called an ICD code, which is an International Classification of Diseases. And I'm going to go ahead and click on this, and we're going to go to a external website. Can you guys see the external website? It says ICD-10 data. Can you see that?
Where would we be seeing that at, Kim?
It'd be on my screen. Can you see it on my screen?
I see where it says link to ICD-10 codes.
Okay, hang on just a second. I'm going to stop sharing for a minute. And I'm going to reshare my screen with that on it. It's right here. Let me just redo that again. Okay, do you see the blue screen now that says ICD-10 code?
Yes.
Okay,
Yes.
great. Perfect. So an ICD-10 code, which is hard for my mouth to say, what this actually is, you guys, is your diagnoses. It's diagnoses. So let's go into endocrine. And in endocrine, I have a whole bunch of different types of medical problems. So I could have diseases of the thyroid. It works for me. So what would hypothyroidism be? I went into diabetes, sorry. All right, so let's say the person has type 2 diabetes. Then we have to look at what type of diabetes it is. So is it due to an underlying condition? Then our ICD-10 code would be E08. Or is this person somebody who is a known diabetic and they're on oral hypoglycemic agents? Then we're going to put the code in of Z79.84. Each of these alphabetical numbers and then the numbers that follow it are associated with a specific disease process and its correlating elements of that process. For example, a person who is a type 1 diabetic, did they wind up having to have their pancreas removed and that's why they're a diabetic? Is it secondary to them developing diabetes in older age? Is it because of drugs they've taken? Is it because that they are pregnant? So an ICD-10 code just relates to your diagnosis. That's all it does. So for instance, I've got a young lady I'm taking care of. She's 36 years of age. She came from a different healthcare system, established with me. I ran her labs, and she was in stage 3 renal failure. And she's 36 and a type 2 uncontrolled diabetic. So for one of my diagnosis codes for her, I can use type 2 diabetes with kidney complications. Okay. The codes help us really refine the diagnosis, but it also speaks when it comes to my billing for my encounter, it speaks to the complexity of the patient. So if I don't properly choose my code and I choose something simple like a type 2 diabetic, and I don't say anything about her renal failure or identify it anywhere as part of her diabetic problem, and then I choose a really high management code, her insurance company could kick it back and say, nope, we're not paying you that. Your codes don't correlate properly. So it's important for you to gain an understanding of your codes, and InPlace will help you do that. So I'm going to share again. And you can look up ICD-10 codes on Google and actually like bookmark one of them for yourselves, okay? But in InPlace, you're going to have your diagnosis for your patient, and just like we had that drop-down menu just a minute ago with diabetes mellitus, you will have that same type of a drop-down menu occur in InPlace for you to choose the code based upon the system that's affected. Now, the CPT codes are a little bit different. CPT codes are procedural codes. So let's say I do a depression screening and it turns out to be positive. I suture a patient's hand. It's a procedure. I do cryotherapy on lesions on a person's body. Those are all codings that I'm able to have a charge associated with. So I'm going to link out, and I have to share my screen again. Hopefully it's going to open. CPT codes are under the jurisdiction of the American Medical Association, and they charge fees, so it's not going to open for me. I'm sorry. The American Medical Association, so you're not easily able to just go and see lists of these because the American Medical Association charges for access to them. So they're embedded inside of InPlace for you to be able to get to. And I'm going to show you an example of that in just a second. So I'm going to move to the next one. All right. So here's the timesheet of a student. They start at 8:30. They ended at 1:30. Their new patient had 2 chief complaints. They had fatigue, and they had they did a comprehensive examination. Here are the ICD codes that the student utilized. So this person had a postpartum mood disturbance, and they also were found to be hypothyroid at the visit. And again, when you are in these areas, there's drop downs. You just click on the drop down and just follow the system. And that's all you have to do really in InPlace for documentation. It's very simple and very straightforward. When it comes to documenting your note, that's a little bit more complicated. And with your note, we have a template, and I'm going to take you into the course after we go through this PowerPoint, but you have to start off with your chief complaint, And then you need to write your history of present illness, which is associated with your chief complaint, and you need to be succinct. Where students in the very first semester have tendencies to have difficulty is the organization of the questions. So let's use the sinus infection. Chief complaint, possible sinus infection. HPI needs to be focused on the sinuses and asking the onset, location, duration, characteristics, aggravating factors, relieving factors, and treatments that the person may or may not have had. And we need to keep it focused here. So we ask all those questions and the patient says, well, you know, I really have a hard time breathing and I feel I'm short of breath. Students have a tendency to put under HPI, patient complains of shortness of breath and difficulty breathing. That has nothing to do with a sinus infection. It is part of the review of systems in the respiratory system, and it belongs down here in ROS, not in HPI. They may say they have a fever. Well, that could go up there, but it could also go under constitutional in relationship to ROS. So you need to be very thoughtful in your questions and what you're putting in your HPI. Patients, though, will throw in all this added information when you're trying to get HPI, and you're writing furiously trying to capture it all, and you stick everything in HPI. You need to separate out what belongs in HPI and what belongs in ROS. You need to be very succinct in what you're doing. We need past medical history, things that are pertinent. So for a focus note, if this person has a history of bad allergies, multiple sinus infections, that would be relevant to the chief complaint. Their gallbladder surgery or their 2 vaginal births, that's not really relevant to the sinus infection. Allergies is important, especially when it comes to antibiotics and things that are seasonal. You need to know their meds. Under medications, a lot of patients are using marijuana, CBD, and hemp, and are using them medicinally, though they don't have prescriptions for them. So you need to make sure, if you're not doing a social history part, that you're asking and documenting if this person is using marijuana or cannabis or kratom for pain management. And you need to make sure you document it there. Your ROS is your review of systems. This needs to be focused. Please put things in their proper places. One of the elements that students sometimes have difficulty with is, where the heck do you put headache? Does it come under HEENT, which is head, eyes, ears, nose, and throat? Or does it come under neuro? Well, if it's just a headache and it sounds like a tension headache, you could stick it under HENT. But if it's got photophobia, there's hyperacusis with it, that's more neuro, and it would belong more under the neuro section. Your physical examination needs to reflect the same things you asked under your ROS. So if you're asking every single system in your ROS, you should be assessing every single system in your PE. With a focused note, you're not going to assess every human body system under review of systems. For instance, with the sinus infection, we're going to do a constitutional, we're going to do respiratory. I always do cardiac because people can take over-the-counter decongestants and it can flip them into atrial fib or atrial flutter, and they'll have an irregular heart rate. But I'll never know that if I don't ask the questions. Then I'm going to make sure I have my HENT, and part of neck can be lymph, so you can put your lymph under your neck if you choose to, or you can make lymph your own category, but it does need to be there. And that's pretty much all I need to do. I don't need to do GI or musculoskeletal or integument. I don't have to do any of that. Just keep it focused. So my PE would just be those elements. Then my differential diagnoses, we ask that you develop 3 of them. And this is the hard part because you haven't had you've had pathophys, where you guys have looked at the body systems and the different medical problems that can happen with them, but you haven't had the diagnosis and management course where we help you refine. So how do you apply your pathophys to making a diagnosis and do it the way that you're supposed to? So it can be a little bit more difficult. There are a lot of books out there that you can get to help you with that. But if you're thinking it's a sinus infection and you think it's frontal, put that first. If you're seeing things that it could just be a upper respiratory viral, put that second. And if you think it's just eustachian tube dysfunction or allergies, then you would put that third. And then you need to write your plan of care out. And your plan of care is three-pronged. So we have in our three-pronged plan of care, we have, are there any diagnostics that we need? Is there any prescriptions that we need to write? And what is the patient education? Please do not go to UpToDate and copy the patient education session from UpToDate and stick it as your plan of care. You will receive 0 points. This needs to be individualized to your patient to address what their needs are from a patient-centered focus. You do need to have this be referenced because you don't necessarily know the things that should be put in here. And by having you look them up and reference them, we're helping you build your memory on how do you take care of these things and what's the most important education that you need to tell a patient. Inside the course, we provide you with 2 different templates. One is a focus template, one is a comprehensive, and you can download them and you can change them any way you want to make them work the way your brain works. The number one thing we need to see is, are you organized in what you're saying and doing? Medicare requires in your documentation that you have the reason for the encounter, the relevant history, the physical findings. If you had to look at any prior diagnostics, so if they had a CBC done or a rapid strep or a preg test, we need to make sure we include them. Remember that every woman of childbearing age who is sexually active, you need to ask what their last menstrual period is, and if there's the potential for them to be pregnant, they need to have a pregnancy test before antibiotics are ordered. Your assessment, which is assessment statement, your clinical impression or diagnosis, your plan of care, and it needs to be dated and legibly identify what your role was in the care of the patient. So what else do you need to have? If you're choosing to order diagnostics or any type of other ancillary service, let's say you're going to send them to the dietitian or you're going to order radiology, you need to make sure that you give us your rationale. Tell us why. I should be able to see really easily why you decided to order these things. Remember that with every lab test or x-ray, you have to have a diagnosis or the insurance company, including Medicare and Medicaid, will deny coverage of that service. Are there any past or present diagnoses that you need to be including, or are you needing to send on to a consulting physician? Okay, so let's say you're dealing with me and I have this sinus infection and I have this past surgical history, which it's important to put in there. I have a past diagnosis of recurrent chronic sinusitis related to latex inhalation. Remember that latex can become aerosolized on powder gloves, and people with latex allergies breathe in the aerosolized product, gets in the nose, major inflammatory responses, which can lead to bacterial infections. Any appropriate health risk factors that you should identify. So let's say I'm coming in with a complaint of intermittent chest pressure. If my family history indicates that my father had a heart attack and died at 40, so did my grandfather, my mother had 3 MIs, my brother had an MI, that's important information. Do I have hypertension? Am I a diabetic? What are my risks associated with my chief complaint being something severe? And you need to make sure that you have them identified. And that would just be making sure that you're putting the past medical history or family history elements as part of your documentation. When you do your follow-up, or if you have a patient in a follow-up note, you need to make sure that you describe how the patient has responded to something. Did you have to revise the diagnosis, or did you have to revise the treatment plan because things didn't work, or patient had an allergic reaction to something, or you found out that for them that drug just didn't work? And make sure that you include that as part of the note area. Depending upon how you choose to write your notes, that could become part, especially the follow-up, that could be part of the HPI, but it also could be part of your management section where you identify that from talking with the patient, you have learned that the original medication was ineffective at day 7 and you wound up changing the medication. Making sure that you're implementing and using the right ICD codes, and that you have those ICD codes associated and in place. So here's an example of a note. So the chief complained. This is actually a preoperative note. And I'll give you guys a little bit of time to read through this. Look at how strongly the HPI is organized. Now, this is one of the notes that came for this particular student probably in the 3rd or 4th month of their clinical. It wasn't her first month. So this is how it evolves into. You can clearly see the old cart. You can see the elements that are associated with the brain tumor being present. Now move into the ROS. Look at that ROS. It's very thorough. But there's like this little blue bubble under neuro. And in just a second, you'll see what that means. That little blue bubble is a comment that I gave to the student. When we are grading your notes, as you've had in your other courses, when you have a written document, where we'll put these comments there, and these comments are to help strengthen your critical thinking and your critical reasoning, and helping you, again, organize the questions that you need to ask to get to these points. So she did a really nice job here. This looks really good. So here's the next piece. Under the neuro, I wrote to her, with the type of surgery the patient's having, she's having brain surgery. I believe that the patient needed to make sure that there was some note about, does she have any speech deficits? How is her gait? Is it a full follow through? Does she have any stumbling present? Does she have any balance issues right now? Because when that brain gets opened up, these 3 things can be significantly affected and could indicate that she possibly had stroked during the procedure. So it's important that a foundation be laid in that note preoperatively. You can see the pertinent medical history. So she's got her allergies, patient meds, her past surgical history, the family history, and her social history. And then moving on, we move into the objective, and you can see my notes to the side on how I felt she needed to expand this even more. There was no eye examination, so there's no reference to the pupils whatsoever. But yet again, if a person strokes, we all know what can happen to the pupils. So those really need to be addressed. When she did her assessment of memory of her neuro, there was no memory, and there was no assessment of balance nor orientation that needed to be included. And you can see the assessment statement that she makes. Your assessment statements need to be brief and to the point. They don't need to include absolutely every single element that is in your HPI. I don't care. Well, I do care, but it's not how the statement is written. It's a concise statement basically stating what you believe is going on with the patient. Done deal. She has her differential diagnoses. Now, because we already know this person has a brain tumor, she did have to research out what other things could possibly be occurring that could cause those same symptoms. And this is what she has listed. And you can see her rationale for her diagnoses, and you can see the plan of care. And as you're seeing these things, there is very strong organization of the note, clarity of thinking, and progression. And this is what you have to be able to demonstrate. As you're first writing your very first notes in the course, we're very generous in guiding. But as we get into note number 3 and number 4, we start tightening the belt a little bit and make you start doing it, not so many errors. And then the following notes that come in this month number 2, number 3, and number 4, we really tighten the belt and we make you own it. If we don't, you're never going to get it, and it's going to be hard for you to progress. We do use the 7th edition APA. So when you are writing papers throughout this entire program in the core, you will be using the 7th edition APA. You do need to set your papers up to the 7th edition APA formatting. We are sticklers in relationship to citation and references in the correct APA format. Please make sure that you're looking them up. You will get points taken off if you do them wrong. And that ends this part of it. So I'm going to stop sharing this, and I am going to share my screen again. And what I'm going to share this time, I am going to be sharing the class. But I'm not seeing the class here. Oh, hang on a second, guys. This was the document that I was telling you about that has the CPT codes. I'm just going to scroll down. Can you see this on the screen? I hope
yes,
you
can.
Good. Okay, so I'm going to scroll down, and you can see there are some ICD codes, so diagnosis codes for some derm things. And then on the left-hand side are some of the codings that you could use for like doing a shave of a dermal lesion. When you type in what you did, the CPT codes pop up. But these are the type of codes that you would use for the procedures. So that's what that is. Okay. Alrighty, so I'm going to do that. Come on down. I have to wait just a second for the Mr. Black bar to go away. Okay. Can you guys still see my screen? And now it's showing AGPC Practicum 1 on it for you?
No, just the AMA website.
Okay, I'm going to stop sharing and reshare. Okay, this is what the course looks like for you guys when you enter in. So this first page, you guys will see when the case conferences are. Each of you is going to be part of the seniors clinic. I'm not going to explain that today. We're going to have an orientation to that our first week of school. But here's where you'll find that information. It's called COAST-IT, and you're working along with medical students and pharmacists in the COAST-IT program. And then there are hours that count towards your clinical in there. Under modules is where all the information is in relationship to the class. We use Piazza. So if you have a general course question, you're going to access Piazza, ask the question for everybody to see, and it automatically populates for me to answer very quickly. COAST-IT, this is the interprofessional program that you will be working in that I'll be explaining to you at the beginning, probably the middle of January actually. But I'm going to move on down. Here is your in-place inflammation. So it tells you how to document an in-place. Okay, so here are the videos. It links out to all the videos. The next piece is, so what do you have to write in in-place? And it reminds you what you have to do. So it tells you what you have to do in in-place. And then the next piece tells you, oh, it's not going to let it go there, sorry. Hang on. go backwards, it's easier. Come on. It's the InPlace login page. And so you can actually get to InPlace through this particular link, or you are able to go ahead and access it through the URL that was sent to you, or you have already bookmarked on your computers. We have general course resources for you. So general instructions on how to document, how to do a focus note in a comprehensive. Here are the snap tools. We have embedded in the course for you E&M charting coding. E&M charting coding is the type of visit that I did with the patient. And we're going to talk about this on your first day, but since you're all here, I'll just bring you down to it real quickly. And it's about, is it a problem-focused, expanded, detailed, or comprehensive examination? And then that then correlates into the type of coding that I would assign in. So I'm going to go down. This is a little bit complicated. In January 5th, CMS, which is Claims Management Services, are changing their documentation requirements. So I'll have to give you a new one on that one. But as I'm scrolling down, right now, these are the things that we have to document to in order to get full payment. And then the codes. Hang on. Okay. So part of the coding when it comes to how I get paid is how complicated was it for me to make the decision I needed to make for this patient? And then how many medical problems did I have to address? The more complex the patient, the higher the code, the more money I get for the patient, for the care I give. This is available to you guys to cruise through. We're not expecting you to know all these. You'll learn them as you go along. So hang on, I'm hoping that no, it's not here. Ah! I'm not seeing the numbers. And it's the numbers that I wanted. So I'm just gonna slowly scroll back up. Maybe I just missed them. Nope, numbers aren't here. I will make sure that we have numbers for you guys in relationship to, so what is a 99214 versus a 99224? We'll make sure that you have that information. So I'm going to pop out of this and pop back into module. Okay. Alrighty. We have coding for you and then an initial physical exam. What do you need to do? All of these are tools for you to help you take that book smart knowledge that you've got and begin to really utilize it and apply it from a real world perspective. This is the preceptor student evaluation form. This document is where you're going to find all your competencies in relationship to this first practicum course. So we have knowledge, we have communication, assessment, your humanistic caring, your ethics, and your leadership. So as you can see in the beginning, we don't ask a lot of you to meet a lot of competencies because you're just figuring out how to do this. As you progress through each of the practicum courses, the competencies increase and you have to demonstrate more. So in the beginning, we're building that underlayment of what you have to show us and supporting you in how you have to do it. So it's actually not hard to meet the competencies, but you can utilize these competencies to write your goals. Alrighty. And then moving on down. This is the assessment form that we, as your site visitors, are going to complete on you. And you have to achieve a numerical score of 12 in order to pass the course, and or not have a student advising notice and then a reevaluation. We typically will do our site visits between weeks 8 and 12 of the semester. If you're struggling, we're going to see it in your notes, and your preceptors contact us and they tell us that you're struggling. We may reach out to you. You may feel that you're struggling, but your ego may keep you from saying, yeah, I'm having a hard time with this. Remember, put all of that at the door when you come into this program now, because now is the time to be honest. I don't get it. I don't understand it. I don't know how to apply it, because we can help you. If you are not self-truthful, you are undermining yourself. We're going to see it and we're going to address it, and we will not let you progress forward. We can't. And it is possible that you may have to repeat this first semester if you are unable to demonstrate that you can apply your advanced assessment skills and interpret the pathophys. We have held students back if they're not able to do it. The reason we hold you back, you have to be able to do it in order to move on to the next step in the critical thinking, clinical reasoning process, which is the development of the differential diagnosis. And if you can't do an interview and you can't connect patho, there's no way you're going to get differential diagnosis. So I don't think that's going to happen to anybody, but it could. So if you're struggling and having troubles, don't be afraid to ask for help. All right, we're here to help you. That's our job. Okay, so that information is there. Then you have your own evaluation to figure out. Each month, now what I'm showing you is the fall group that's up right now. Every month is written the exact same way. You've got an overview. You have some maybe helpful articles. You have your goals. These are for September, but you're going to have goals for February. We've got the rubric. The rubric is going to be tweaked just a little bit before you guys come in. Then the next piece you have to do is your reflection of goals. And then the next piece you have to do is your notes. Now, right now, there is a note due every week in February. You're going to be starting clinicals in January. And you could take a January note, upload it into February, that's fine. But you have to have 4 notes and you need to submit them 1 every week. You have to look at our comments right now before you submit your next note. We may be changing that format because there's some issues with Canvas in it. We'll let you know if we do. There's a difference. Here's your in place. You have to document 2 encounters. And for your note, you have to do 1 focused or expanded note each week and upload it to Canvas. You will only be graded on the last note that you upload for the month. We give you 3 weeks of opportunities to make changes and improve. If you choose not to use the mentoring that we provide you on the notes, and you believe that you're doing it perfectly, but we're telling you you're not, you will not get a good score on your note. And not getting good scores on your notes can potentially cause you not to pass the course. Documentation, besides being able to engage in an encounter, are the 2 critical role aspects that this class really hones in on. And if you're struggling, again, just ask for help. We're here to help you. Okay? In place reminder on what you have to write in place is here for you guys. The rubric might be changing just slightly, but you can see we're assessing every element. If you do not document weekly and in place, you get points taken off. Why? Because we have to provide weekly feedback to administration on where students are at, how many hours are being completed, what type of patients they're seeing, especially right now with COVID. Everything is being monitored on a weekly basis, and I have to write reports. So in January, we're still going to be dealing with COVID. So you need to make sure, and you can document at the end of the week, but don't wait and hold back until the end of the month to do all your documentation in place, because if you do, you're going to get a 0. Which also means that for no documentation, you will also potentially get a 0. Each of your rubrics are currently connected into outcomes of our program, and you will be assessed on these as well, but these points do not count towards the total points of the assignment. They just correlate to your level of achievement in relationship to meeting the outcomes. Back into modules. Okay. Then if we're going to have you do anything before we have our case conferences, case conferences are usually the first Tuesday of every month. For you, the first Tuesday of the semester, we are having a case conference, which I can tell you what date that is. And it's from 3 to 5 p.m. So hang on just a second and I'll tell you the date on that. That would be January 26th from 3 to 5 p.m. We are having a case conference. And at that case conference, we're going to be going over the COSTIP program, we're going over how do I do an E&M code, how I know what they mean, and then answering questions and getting you ready to move further in. October is set up exactly the same. So February will be the same, March will be the same, April will be the same, and May is basically our wrap-up month because that's our last month. In relationship to, I'm going to stop sharing the screen. Does anybody have any questions about the course and how the course is set up? Okay. So in relationship to your preceptors, in place is where you are going to find who your preceptor is and the preceptor's contact information. You can look now. If you do not have your compliance elements all up to date, you will not see your in place placement. We have to have you compliant with everything prior to starting the semester because we have malpractice contracts that are written for each of you. And those contracts are based upon your compliance with having your license up to date, your ABD account up to date, that you've done your OSHA, you've done your HIPAA training. All of that has to be current, your TB, so on and so forth. If it's not, it means that we're in violation of your malpractice and potentially could open the college up to a lawsuit if something would happen. And a lot of the healthcare systems will not allow you to step foot on their property to even start clinicals if you are not compliant. So we have to make sure you got that first. If you're all good with that, then in place you'll find all that stuff. Email your preceptor, introduce yourself professionally to your preceptor. Let them know that you would like to begin working on setting up dates for your spring semester, and you can land on, every Wednesday. Now you have to work with the preceptor's schedule. You don't get to tell the preceptor, I'm going to come every Wednesday from 8 to 5. You don't get to say that. You are a guest at the preceptor's site. You have to accommodate what they can do. Ask them what day would work best for them to have you be at clinical. Let them know that you need to be there at least one day a week. Okay. Some of them are doing telehealth as well as in person. When we have our orientation on the 26th of January for Coast-It, we're also going to be orienting you on how do you do telemedicine? How do you do telehealth? So we will be sharing all that with you guys and helping you get skill sets in that as well. When you email them, be open, be friendly, okay? Please do not in your email say that this isn't a site I really wanted, I was just placed here. That is unprofessional, and you'll have to speak to me on why you wrote that, because your preceptors send that stuff to me. And yes, I've had students say that to preceptors, and then we lose a site. You are placed in a clinical site that meets the requisites of this particular class. It's working to help you hone skills of your interview for your chief complaint, HPI, and ROS with very strong preceptors. Not everybody is going to a primary care clinic. Some are going to rehab. Some are going to home visits. Some are going into surgery clinics, palliative care or hospice. Those are actually considered primary. And so you may not be at a site that you really think is beneficial to you. You need to be open-minded to everything you can learn from these preceptors because they've been doing it a long time and they're exceptional. So just sharing some feedback with you on things not to do that could potentially require you to talk to me about unprofessional communication to a preceptor. And you really don't want to talk to me about that. So just don't do that. These have happened and preceptors have kicked the student out and refused to take the student because of those type of things being said to them. So just be professional. Questions? Okay, I think.
Oh, sorry.
Go ahead, Beth.
So because I'm kind of setting mine up a little differently out here. Am I looking to do like the second week in January to get rolling with it, or the third week?
I have emailed out, Bev, and asked where your affiliation contract is at with that site, because I did send it on the 20th, right after you.
Okay.
So you can't do anything. I mean, you can contact them and start setting up your dates, but you can't step foot on their property until we have that affiliation agreement signed by them. And I'm waiting for them to let me know they've got it, where they're at with it, and I'll let you know.
Okay. I was just trying to plan with the preceptor I have out here, because I know she was initially, they were kind of timid with COVID and trying to push it even a little further, like to the end of January, early February.
You can start in the beginning of February, but what it means is that there is probably going to be some weeks that you may have to be there twice a week to make.
Okay. And I was okay doing that. I just want to make sure that was okay.
Absolutely. As long as it's okay with your preceptor.
Yeah. And that was because she was wanting to do a little later because of the vaccine rollout with how hard they've been hit.
I totally understand that. And right now we're pretty much at the mercy of every healthcare system. UC Health is pulling their outpatient nurse practitioners to inpatient, which means that those of you that may be at a site where it's an outpatient NP, that NP could get pulled to inpatient and you won't be able to start your clinical because they're working with COVID patients on an inpatient acute care mode. You're a primary care nurse practitioner. We don't do inpatient. So it may put us off. So far, I've only received notification from 2 preceptors that this may be an issue, but they won't know until January. So we're going to carry forward as if we're all going to clinical like we're scheduled to. All right.
Dr. Paxton, I have another quick question. So I am compliant as of today. I got my QuantiFERON back and uploaded it. How soon would I expect to be able to see my information in place as far as clinicals?
Give it a week. It should be there probably by Thursday or Friday. Michelle, make sure you let Michelle Wilcoxon know.
I did. I emailed her.
Perfect. She'll respond on Monday. Then she'll release a hold on you. to the graduate placement office. Graduate placement office will then, I've got a pretty intense grid where everybody's at with everything going on. They'll go to the grid, pull the information, put it on into InPlace for you, and then you should receive an email from them letting you know that your practicum placement is available to you to view through your InPlace account.
Perfect. Thank you so much.
Oh, gosh, you're welcome. Good question. InPlace is where we're doing a lot of things. There's a lot of process changes taking place for the better, not for the worse, but for the better. So if you get an email from Krista New, Farrah Bowler, or Crystal Gallegos, please don't ignore those emails because there's a lot of process changes happening right now. And they're probably asking you to do something or want you to be aware of a change. You may even want to make your little folder that may be a graduate placement folder where you just stick everything that comes from these guys so you never lose anything. It's like, oh my God, I don't have time to read it now, but I want it out of my mailbox. It's just really helpful because so much information comes to you guys. It's like overflow. But it's a good way. If you ever have questions and you're not sure if you've met all the requirements, shoot off an email to Michelle Wilcoxon. She will tell you exactly what you're missing. I do get naughty lists from Santa, which is Michelle. And then I have to send out nastygrams, reminding you guys, I am not going to put you at your site, blah, blah, blah. You have to get this done. It's not because I'm trying to be mean. It's because of the malpractice that the university has. And if you don't do it, we can't send you. This is the bottom line. Okay. Other questions? If things come up, please make sure you shoot me off an email. Just let me know. Okay. And I will go ahead and respond back to you. I am going to be working. I'm still working from home, but is it next week? I think the week after next, I'm not going to be working every single day answering emails because I'm going to take a little time for Christmas. And then I'll be back into it again, probably that last week of December. So give me about 48 hours to respond. If you don't hear from me within 24, it's just because I probably am only working a half day that day. Okay, but you'll hear back from me. My cell phone number is listed in the syllabus. You guys are 5971. I am not going to be your clinical instructor for the spring. You are going to be having Dr. Kelly Hendricks and Dr. Paisley Johnson, who are going to be your faculty for the course. I will be your preceptor for the COSTIP program. So I'll be doing that orientation on the 26th with you related to COSTIP and stuff, but that's my role. And you have Paisley and Kelly as your instructors for the course. Actually, I'm in 5972, which is the one right after this one for the spring. Kelly and Paisley are amazing. They're wonderful at mentoring and guiding. You're going to love them. They're just really good people. So that's who your teachers are going to be. I'm going to be opening the course up probably the second week of January. I have some revisions to make to it, and I want to do some work on some of the rubrics. So you'll see that populate where you'll be able to see it probably the second week of January. It's possible I could open it sooner, but I doubt it very much. And actually, I think it's Kelly who's actually opening it up. I just have to make the changes to the rubric, but Kelly will be opening the course up to you. Okay. Other questions? All right. You guys, thank you for doing this again. I'm so sorry that God blessed me with no internet on Friday, but thank you for coming today. I will be uploading the recording for your colleagues. If you have questions, shoot off to me, shoot off to Kelly. But most importantly, please stay safe, please stay healthy, and have a wonderful holiday coming up. And it's going to be wonderful to work with all of you. Take care of you guys, okay?
Thank you, Dr. Paxton. Same to you.
You're welcome. You guys, you can call me Kim in this environment. Only like other places you have to call me Dr. Paxton. Just call me
Okay,
Kim.
thanks, Kim.
Bye, you guys. Take care of you, okay?
Bye.
Bye.